Well, when it comes to healthcare choices, patients have never had more options. But if you're sick or facing an emergency deciding where to get treatment, well, that can sometimes be a little bit confusing. Dr. Nidhi Kumar is on call for us this morning with advice where to go when you need to see a doctor. And Doc, good to see you.
Good to see you.
All right, so let's talk about the new choices available. What are patients out there? What are they experiencing? Why so much confusion?
Everything happens so fast.
Yeah.
I mean, for the longest time, there were two places, right?
Yeah.
You either went to your family doctor or you went to an ER. Now there's primary care doctors, specialists, subspecialists, urgent cares, ERs, and then your own living room. It's confusing. And the complexity of the system is driving people to make the most extreme choice when they are sick, which is the ER, because they're panicking, they're scared. And then we also have this big uninsured population that is using the ER for basic medical care. Well, the result is 130 million ER visits a year, 30% are avoidable.
Yep.
This translates to billions and billions of healthcare dollars lost. Healthcare spending by 2030 projected to be $6.8 trillion. We need to get smarter or the system is going to collapse.
Is it one of those things where there's so many sicknesses out there and people are so scared they don't know what they've got, so everyone thinks the worst considering where we've been the last 3 years? But let's talk about the ER, because you talked about that. When is it appropriate to go to the emergency?
So the ER is for life-threatening issues: chest pain, severe difficulty breathing, bleeding, serious injury, or anything involving the head or the brain. So concussions, seizures, stroke-like symptoms. These are, and this is not a huge list, but these are really the reasons to go to an emergency room.
It's got to be bad.
It's got to be bad,
Self-inventory, you know if it's bad, and then you go to the ER. How about these urgent care centers? Because they're all over the place.
Yes.
Is it a good idea to visit them?
So this is for those non-life-threatening situations: strains, sprains, cuts that require minor stitches, asthma attacks, moderate flu-like symptoms, and anything involving your abdomen, abdominal pain, nausea, vomiting, diarrhea. So urgent cares are capable of quite a bit. You can get breathing treatments, medications, get x-rays, IV fluids, and this phenomena really took off because patients were looking for a fast and affordable option. So take something like an asthma attack. A moderate asthma attack. If you go to the emergency room, you're going to be there for several hours, and the cost is about $2,000. Walk into an urgent care with those same symptoms, you'll probably be seen within the hour, and the cost is in the hundreds of dollars. Same issue, different experience.
Yeah, it's funny you talk about going to the emergency room and you're going to be there for hours. It's kind of similar to going, like, so when you go to the DMV. You just know you're never getting out of there quickly. So if it's not really bad, you might want to think about it.
But in the DMV, you keep your spot in line. In the ER, the sickest person is going to cut you. Think of it that way.
That's why urgent care, like you mentioned, is a good alternative. Let's talk about telehealth, because again, during COVID, this really kind of rose to the forefront where you can just kind of zoom in with doctors where you don't necessarily have to go to the doctor's office.
Telehealth, it really took off. So there's a broad range of issues we can tackle with telehealth, from simple to very complex. So it's a great setting to get your prescriptions refilled, go over blood work with your doctors, get treated for infections, allergies, or even management of chronic issues: high blood pressure, diabetes, cholesterol. But we can also do some pretty sophisticated, complicated management over telehealth. So take, for example, one of the sickest patient populations, people with congestive heart failure. 6 million Americans are living with this. They live in a very delicate fluid balance. So if they retain fluid, they go into the hospital. So during a telehealth visit with a patient with congestive heart failure, a doctor will observe, can they get through an entire sentence without taking a breath? They'll ask the patient to turn their neck to the side, look to see if there's dilation in the veins of the neck, and then ask the patient to flip the camera onto their legs and see if the legs look swollen. Now, if any of these signs are present, it suggests that a patient is experiencing worsening heart failure. Right then and there, we can make modifications to medications, prevent patients from getting sicker, and prevent a hospitalization.
And if you really need to go, they can tell you either go to the ER or go here or go there.
But we can prevent hospitalization, prevent people from getting sicker. So it's really powerful. More people need to embrace telehealth.
No kidding. No kidding. It does seem like an easier alternative. Doc, thank you. Good to see you.
Good to see you, too.
Very good to see you. Okay, on call this morning with Dr. Kumar. It's always good to have her here.